Mr. President, I come to the floor today, as I have week after week ever since the President's health care law was passed, to bring a doctor's second opinion about the health care law. I've traveled the state all the last week in Wyoming talking to people about the things that they look for in a health care law, which is what they want as patients, as citizens, and they look at it as what they're looking for is the care they need from a doctor that they want at the price they can afford. And across the board, they do not believe that they are getting that with the health care law that was passed in this body and then in the House and signed by President Obama during the last couple of years of the administration. And it's interesting, as we went to the floor of the House in the House chamber this past week for the President's State of the Union speech. It was almost 7,000 words, and he focused very little on the health care law. You say, well, why is that? Well, it seems pretty obvious. It's because that law was unpopular when it was passed, and it is actually more unpopular with the American people today than it was the day it was passed. And the more people find out about it, the less popular it becomes. And even the White House understands that this law is deeply flawed, it's extremely unpopular, and it actually makes it harder for small businesses to create jobs. So when the President wants to talk about job creation in America, he realizes that his health care law isn't helping, and it's actually making it worse. I had town hall meetings, different communities around Wyoming last week, and when you gather a group of people together, and our colleagues ought to do the same thing in their own communities, in their own home state. Ask a group of people, do you believe under this health care law that, you remember the one that the President promised that if you passed that the cost of your insurance would go down? Remember that law? Do you believe that after that was passed do you believe that your health care costs will actually go up? How many believe the cost of your care will go up and your insurance will go up? Every hand goes up. And then you ask those same people who now say they're going to end up paying more, you say, do you think that the quality, because there's a lot of discussion about quality and access and concerns about care, do you believe that the quality of your care will go down? Again, the hands go up. So you have people that are saying, we're going to be paying more and getting less, and that's not what I want. So today I'm here to discuss something about the health care law that the President really did leave out of his big speech on Tuesday night, and that's the issue of waivers. January 6th, while we were all back in our home communities, many people talking to folks around their home state, January 6th, while Congress was not in session, the House was not in session, the Senate was not in session, the administration ended their program that has really been a major embarrassment to the Obama administration. And month by month, the President has had to announce that he had to issue more and more waivers from his health care law. Waivers that the President granted to unions, to businesses, and to insurers. Each and every waiver served as a clear admission that the health care law, as written, didn't get the job done, doesn't work. Well, as of now, January 6, 2012, the administration has issued a total number of waivers that covers more than 4.1 million Americans. Over 1,700 waivers were given, covering more than 4.1 million Americans. Now, interestingly, of all of those people, a very small percentage of them, of workers in this country, are union workers. But yet, over half of all the waivers given, 2.2 million of those people were those who are covered with union insurance. So you have 4.1 million Americans given waivers, 2.2 million people with union insurance got a waiver. That's 54% of all of the waivers went to union employees who supported the health care law. These are the people that were out in the streets rallying. They say, we want the health care law. They have it on their websites. They had celebrations when it was passed. And then, remember what Nancy Pelosi said, first you have to pass it before you get to find out what's in it. And as all these people getting their insurance through unions found out, that if they complied with the law as written, that it would break their policies, break their programs, and they said, we cannot afford to have this law apply to us. Please give us a waiver. 2.2 million people with union insurance got a waiver. And as I say, they let the word out January 6th, 2012, while Congress was not in session and while people were focused on other things. Well, the rest of America's small business owners were not so lucky. A new poll from the Chamber of Commerce found that 78% of small businesses surveyed reported that taxation, regulation, and legislation from Washington made it harder for their businesses to hire more workers. In that same poll, these are the small businesses of the country, the people that are the job creators. In that same poll, 74% of small business owners said the recent health care law makes it harder for their business to hire more employees. Now, aren't these the very people that we're asking to go out and hire more workers, to get America back to work? But yet the President and the Democrats' health care law is making it harder for 74% of our small businesses in this country to hire more employees. So how did we get here? Well, in May of 2011, I came to the Senate floor right here and explained that the waiver recipients, under the way it worked, had to reapply because they were getting annual benefit waiver limits year after year after year. Well, realizing what an embarrassment this drip, drip, drip of new waivers was going to be by the administration, in August of 2011, the administration switched course. The Department of Health and Human Services announced that at that point, if you wanted a waiver, you were going to have to apply for a final waiver that would carry on all the way through 2014, a 3-year waiver. And they wanted to get all of this out by the beginning of 2012, so it wouldn't be a continued election year embarrassment for this president, this administration, and those who voted for it. This scheme allowed the administration to dodge issuing more waivers leading up to the 2012 presidential election. It's clear that these waivers were going to be an election year embarrassment for the president. They were an embarrassment because each and every waiver was yet another reminder to the American people that President Obama's health care law wasn't working. The president promised, and we remember hearing him loud and clear, that if you like the health insurance plan you have, he said, then you could keep it. Well, what he meant was, to keep the coverage you have if you like it, you may need a waiver from Washington. I also want to talk for a moment about what happens now that the September deadline has passed and these 4 million waivers have been granted. It's now no longer possible to apply for an annual benefit limit waiver, no longer an option for business owners in this country. So that means that it leaves hardworking Americans who want to start a new business forced to choose between 2 options, and I think they're bad options. One, they can offer high-cost, government-approved health insurance. Well, that's going to make it very expensive for them to try to open a new business and hire workers. The expense of opening that business may likely be too great. So those jobs are not created and unemployment rates stay high. Or 2, don't offer coverage at all because they can't afford the health care law's onerous mandates. And if they choose that second option, what happens ultimately? Well, the American taxpayers will end up footing the bill. With a $15 trillion debt and unemployment hovering around 8.5%, the last thing we should do is adopt policies like this health care law and then this waiver plan that discourage America's best and brightest from starting new companies and hiring new workers. But that's exactly what President Obama's health care law does. Stifles innovation, strangles the market, and it straddles the American people with more debt. This is just another example showing how the president's health care policies are making the situation worse. His policies are hurting America's economy. His policies are making the standard of living in America worse. His policies are making health care in America worse. And his policies are making America's debt worse. You know, almost immediately after President Obama signed his health care bill into law, the employers around the country began to sound the alarm. They said that the health care law's annual benefit limit policy would force them to stop offering health insurance to hundreds of thousands of Americans and their families. That's why the administration came up with this waiver idea. Nowhere in the health care law is the Secretary of Health and Human Services granted explicit authority to start an annual benefit limit waiver program. Nowhere in the law. What the administration should have done was come to Congress and asked for help to fix the problem that they had created. That would mean, however, that the President and Washington Democrats would have to admit that their health care law was flawed. Washington Democrats crafted a policy mandating that everyone must buy government-approved health insurance. In many cases, it's insurance that these individuals don't need, don't want, and cannot afford. The President pushed his mandates on the American people without understanding how limited health insurance products work in the marketplace. The administration simply ignored the fact that many employers cannot afford to offer the Cadillac health insurance coverage to their workers that the government is mandating. But now, if those businesses don't have a waiver already, they won't be able to offer their employees any insurance coverage at all. And new business startups won't have the opportunity to ask for a waiver. Those employers might have wanted to offer some basic level of health insurance coverage to their new employees. But thanks to the Obama administration, they won't be able to offer anything at all because of the expense. This is just another example of Washington Democrats pushing a one-size-fits-all, we-know-best policy where they think they know what's best for all of the people of this country. How many more disruptive ticking time bombs are there lurking in this health care law? We don't know because many of the provisions do not even go into effect until 2014 or later. And that's why, Mr. President, I come to the floor week after week giving a doctor's second opinion to mention and to tell that I intend to fight each and every day to make sure the American people will never have to find out come 2014. I am committed more than ever to repeal the health care law, repeal it and replace it with health care reforms that help American families get the care they need from a doctor that they want at a price they can afford. Thank you, Mr. President. I yield the floor.